watch your mouth.
All right, and we are back with our dental expert, Dr. Ron Walker. We love having him on HTV. He's our HTV expert, helping you out each and every week and trying to teach us all about the mouth and what it's all about. Good to see you, Doc.
Good to see you, Mark.
Belated Merry Christmas and Happy New Year.
Merry Christmas to you, too.
I want to say hello to your grandmother, too.
Thank you. I'll let her know.
Great lady, for sure. All right, we talk about crowns. Crowns are, we hear it all the time. We talk about it. A lot of families know about it, but what is a crown?
Crown is one of our tools that we have to restore a tooth back to proper function. When a tooth is broken or decayed and missing some of the tooth structure, one of the options, your first option is going to be a filling, and that's going to be what we call direct restoration. The next thing is going to be a crown when that filling gets big. When it's indicated, a crown is something that's made out of the mouth in a lab or in an office in a milling machine. So we can look at a picture right now of, what kind of a tooth might need a crown. That right there at the bottom of the screen, that would be a great tooth for a crown. It's really broken down, it's missing some tooth, big old filling. That would be a tooth that needs a crown, just from loss of tooth structure. Go to the next picture here. Okay, so any tooth that's most likely when you have a root canal, you're going to have a big filling. Those two teeth right there, one with a root canal, one without, both of those have enormous fillings. Those would be indicated to have a crown on those also.
Can I ask you a question while we're on this? Well, you see one, you could distinctly see the white nerves. What's the difference?
Well, the one that you can see the nerves, the canals on, that is the root canals. That tooth has had a root canal.
Okay.
Okay, the one in front has not had one.
Gotcha.
And you don't always have to have a root canal to have a crown. Okay, you can have a crown without a root canal. Actually, you prefer to avoid the root canal.
Wow. Okay.
So those are reasons why you would need a crown based on just loss of tooth structure, but also the other reason you would need a crown is for fractures. So if you forward, teeth that are what we call virgin teeth, that don't have any restoration at all, no filling, nothing wrong with them, sometimes they start to fracture. And if you are biting and it's sensitive when you bite specifically, and we see this when we transilluminate that tooth with light, that tooth is indicated to have a crown. There's one more picture of that. Here's another one with a filling in it. A lot of teeth have fractures, and just because it has a fracture in it that you can see doesn't necessarily mean you need a crown on it. But if you're biting and that is hurting, that means that fracture is opening up the tooth, and you better crown it before you lose the tooth, because it can fracture all the way into the gums and you can lose a tooth.
Teach me about the technology here. What's the green and all that?
There's no green. That's just the way it's exposed. It's just That's just the light shining through the tooth, and when it's fractured, light won't transilluminate through the tooth. It'll stop at that fracture, and that's what you see. And the dark spot in the middle, that's actually an old silver filling.
Okay.
So that's a silver filling, and that's just what it looks like when you have a fracture. If the fracture wasn't there, the light would go through the tooth.
So light is a dentist friend.
Yes, absolutely. Diagnostic tool.
Yeah, there you go.
Yes.
All right. So do we have another picture at this point here?
So the next thing is going to be, what crowns look like. Here's what crowns look like when they come back from the lab. We take an impression, and the lab's going to make, these are two front teeth here and two crowns, and that's just porcelain crowns, right? So crowns can be porcelain. You can also have them made out of zirconia, which is a much stronger tooth-colored material, and they can also be made out of metal, either gold or white gold, silver.
Why the different options? Some people allergic to some things? Or?
Allergy is one issue, but mainly just aesthetics, really, and then function too. If you're going to put a crown way back in the back of the mouth, you don't need it to be as pretty as the crowns are going to be in front of the mouth, like those two crowns.
That's a good point. Yeah.
The prettier the crown, typically the weaker it's going to be. So if it's porcelain, they're going to be more translucent and be more beautiful, but they're not going to be as strong. Whereas if you're going to do a crown on a molar way back in the back of the mouth, you might want to pick a material that's a little stronger and won't break as easy.
That's pretty interesting, because I guess most of your chewing is in the back of you.
Right.
So you got to have something tough.
Correct.
To make sure it works.
Exactly.
Okay, and I know we have a couple of more pictures.
So here's just a picture of a crown in the mouth. And that's what a molar crown looks like. That's a zirconia crown. I think we may have one more. Okay, and then sometimes when your teeth are worn down to nothing, sometimes you need to crown all of the teeth, and that's what you're seeing right here. Those are all porcelain crowns. That is a full mouth of porcelain crowns.
It looks fantastic too.
Yeah. So that's a what we call a full mouth rehabilitation. When teeth are broken down bad enough, sometimes you need this.
This is sort of being a doctor and doing what you do. You almost have to sort of be an artist at the same time.
Right. Yep. One of the hardest things that we have to do is to get a single front tooth to match with porcelain. It is very, very, very difficult to get one tooth to match. When you're doing two like that, it's not as bad. But if you take one front tooth and match, and I'm sure you see plenty of people like this that have a crown, and you go, it just doesn't look right. And that's because it's a crown. It's just a really hard thing we have to do.
So I guess if you had to do all the fronts,
It's much easy. It's easier to match because they all look the same. You're not really matching anything. They're all the same thing. But when you start dealing with materials like porcelain or zirconia or filling materials, trying to match a natural tooth structure, it's very difficult to do.
Yeah. And so when y'all do crowns, do y'all make your own crowns or you send them off, or is labs
Either or. So you can have a lab make them. You can take impressions, send them off to a lab, and they can make it for you. Or nowadays you have milling machines that can actually mill crowns in the office. Yeah, so
Technology.
Yes.
It's come a long way.
Yes, sir.
All right, Doc. Good to see you again, and
Thank you.
Can't wait for another topic.
Thank you, Martin.
All right. Once again, Dr. Ryan Walker, our dental expert here at HTV, and a very interesting show on crowns. We'll see you again next time, right around the corner.
Watch your mouth.